Caregivers that have helped save the life of 37-year-old ranking officer following a life-threatening injuries. I acknowledge the presence of Dr. Nitin Jagasia, CEO, COO and Unit Head, Apollo Hospitals Navi Mumbai, and Dr. Brajesh Kumar Medical Services, Apollo Hospitals Navi Mumbai. To set the context and share the significance of this remarkable case, now I invite Dr. Nitin Jagasia to please address the crowd. Ladies and gentlemen, please give a huge round of applause.
Thank you. I'm not sure what I should talk. I'm sure my clinician will have that decision and experience that case. I would just highlight two things here to media. The purpose of all of you here is to pass the message to the community about the importance of such injuries and timely mental health required. And specifically, thank you family who has actually done more than what it requires to support that young person to recover through these injuries. As a large facility, it's our responsibility to ensure all the support services and the treatment related aspects is taken care. This is an extraordinary case where multidisciplinary inclusion is required, and I'm sure my physician will explain how we have gone through it and near perfect recovery for this individual. We'll be happy to have more questions as we speak. Thank you. Thank you.
I request Dr. Ravi Shankar to please address the crowd. Ladies and gentlemen, please give a huge round of applause.
Good afternoon, everyone, and thank you all for sparing your time and coming here. So here today we are here to talk about details how multidisciplinary, well-lit team can do wonders to save life of an individual. So here was a 37-year-old young man, a marine engineer, who came to us briefly, stayed in the nearby hospital, and then he came here. He had multiple injuries, fractured pelvis, femur, both upper arm, crushed right hand, pulses, movers, and he had vascular injury, and it required a well-lit, timely emergency response from multidisciplinary team, which happened in our hospital. It happened only at a place like Apollo, where we have all the wherewithals, all the specialties, all the skill set available under one roof, which can come together in no time. Within 45 minutes, the patient was shifted to the operation theatre, where the team of orthopedic surgeon, the vascular, plastic surgeon, the CBT surgeon, cardiologist, they all came together and did the emergency surgery. The patient had to stay in ICU for more than 2 weeks. The patient was on ventilator for 7 days. And in the layman's language, if I tell you that the patient had such bad injury that a team of surgeons will not know where to start and where to finish hospital first. But hats off to our clinical team that they fixed the injuries and they recovered the patient in such a manner that the patient is having rehabilitation now and is going to be discharged very, very soon. And is going to be on his feet and about to start work. So it's a miracle, it's a wonder, and that's why we thought that it's important that this case we discuss along with you, and the message needs to go to society. How emergency response and multidisciplinary team response has to be there in the hospital to save this. Thank you very much.
Thank you, sir. Now, to take us through the clinical journey of this challenging case, we have a that we. So we would like to invite Dr. Sameer Chaudhari, Consultant Trauma, Orthopaedic and Joint Replacement Surgeon, Apollo Hospitals Navi Mumbai on the stage. We have Dr. Nitin Jagasia, the Regional Director, Emergency, Western Region, Apollo Hospitals, on the stage. Ladies and gentlemen, please give a huge round of applause. We have Dr. Charudatta Chaudhari, Consultant Plastic and Reconstructive Surgeon, Apollo Hospitals Navi Mumbai. Dr. Sachin, may I please invite you on the stage. Our CBTS Surgeon, Apollo Hospitals Navi Mumbai. We have Dr. Kanchan Singh, who will be representing our anesthesia team, Apollo Hospitals Navi Mumbai. We have Dr. Pallavi Patekar, a consultant physician, Apollo Hospitals Navi Mumbai. Ladies and gentlemen, please give a huge round of applause. To take us through this clinical journey, we have Dr. Sameer Chaudhari, who will explain us the clinical process.
Dr. Brajesh, please join us. Dr. Brajesh Kumar is a cardiologist who helped us to this case. Please come on stage. And Dr. Irfan, please join us. Good afternoon, one and all. I understand the majority of the guests who have come are Hindi and Marathi speaking. So we have a talk which will be a mix of Hindi and Marathi. So me, Dr. Sameer Chaudhari, Orthopaedic Surgeon, Apollo Hospital. आपण आजच्या पेशंटबद्दल बोलणार आहोत. 37 years दुबई इंजिनियर आहे आणि आमच्याकडे ते एक्झॅक्टली 6 weeks अगोदर आहे. आज दुवा आहे 6 दिवस आहे सकाळी आपल्याकडे आले. So basically we are talking about from near fatal polytrauma, the Charudatta Chaudhari. It was a remarkable recovery to a stage where the patient will be able to right now sit and work on the desk as well as taking to the next level where he should be independently work. So first of all, I thank Mr. Cardiology Department, and their friends and family for their patience, cooperation, and maintaining trust in our hospital, Apollo Hospitals Navi Mumbai team. So over the 6 weeks period journey, he's still with us. We have been really patient. So it is quite overwhelming for any person to go through a trauma, multiple surgeries, deal with so many doctors. General perception of patients where they feel that a patient gets treated by 8, 10, 20 doctors sometimes can irritate them, where they get the feeling that we are treated as different organs. But this patient, his friends and his family actually understood that concept, that how this team comes up together with each person of multiple years of training and experience to give a result. And they were patient throughout to understand, talk, ask questions without doubting the intent. So first of all, we thank them for this and for allowing us to present their case to the media and also giving timely feedback to us. So this was the case. It happened on the night of 13th of May, and it happened around 2 or 4 o'clock in the morning. Patient suffered accident injuries and was shifted to another center. 7:45, 8 o'clock, he was moved into Apollo Hospital. So patient जब आए वो बोल रहे थे बात करते हुए आए थे, तो उनको जो इंजरी हुई थी, तो आई जस्ट पुट लाइक डॉट्स जहाँ पे इंजरी हुई थी, तो इनको मेन था चेस्ट ट्रॉमा, aortic dissection. Aorta is our main blood vessel which gives blood flow to the body. Along with that, ये pulses आए थे, तो इनके all 4 limbs there was no pulse, but he was still talking. Mangled right upper extremity, crushing था पूरे arm का, where all these bones, muscles, nerves, and even blood vessels were exposed. He had a major pelvis fracture. So pelvis is our main organ. जब pelvis fracture होता है तो 2 से 2.5 लीटर blood loss होता है एक दिन में. Average body में 5 लीटर blood loss तो almost 40-50% blood loss वहीं होता है. Then we had multiple long bone fractures, the thigh bone, leg bone, upper arm की forearm की fracture होती है, left arm की fracture होती है. Severe blood loss and hemorrhagic shock. And because of the blood loss, the body was in shock. That is the stage presented. And there was a risk of multiple organ failure, infection due to contamination. The contamination was mainly because of the grease, mud, etc., in which the patient had to suffer. Now, this condition upon arrival was critically ill. He was hemodynamically unstable with massive blood loss and he required immediate resuscitation. So as soon as he reached the emergency room, our emergency medicine head Dr Nitin Jagasia and his team attended to him. They activated a rapid response to this and trauma management system. So we are speaking, as we are speaking, say if our program is of 1.5 to 2 hours, you imagine all these things that they happening in 1.5 to 2 hours. The patient coming in, minimum 4 to 6 doctors attending him at the emergency to stabilize him. Within 15 minutes of primary surgery, initial stabilization is done. Patient is shifted to the CT scan to see whether the blood flow where all is cut off. And as soon as that is done, by this happening simultaneously, all the teams are assembled. So when the primary team survey is done, they understand that okay, orthopedic surgeon, cardiologist, cardiovascular surgeon, plastic surgeon, vascular team has to be involved. That's the beauty of this system, where everyone is available throughout the day. So with the number of team members available, with expertise belonging for so many years. The team was assembled and the plan was decided and patient was wheeled in the operation theatre. This is happening within 1 hour. So coming in, going to the CT, getting primary assessment done, stabilizing him, and even the operation theatre is ready as we are talking, and the patient was wheeled in there. वहाँ जाते we had to make a plan. So the anesthetist Dr Nitin was the first one to receive. तो जैसे ही वो रिसीव करते हैं, कोई इंफॉर्मेशन पास होता है, it is used and patient is taken into the operation theatre. When we are in the theatre, we are almost 14 or 17 people there. And सबसे बड़ा चैलेंज होता है कौन क्या पहले करेगा. वो इतना कॉन्शन होता है, इतना केओस होता है वहाँ पे, तो उसमें एक मेथड फॉलो होती है. So the anesthetist is the teacher, वो उनको पेशेंट को उन्होंने स्टेबलाइज किया. फिर हम 3 ऑर्थोपेडिक सर्जन थे, मैं डॉक्टर शेख और So we discussed with the cardiologist, we discussed with the plastic surgeon. So इसमें पहले होता है लाइफ सेविंग. तो लाइफ सेविंग क्या है? Blood loss is the main thing. जिससे जाना जा सकती है. So we have to reduce the blood loss. कितना कम से कम blood loss होगा और कैसे हम रोकेंगे उस पे काम करेंगे. So the first thing was decided that we stabilize the pelvis, arm and the thigh, जहाँ से main blood loss है. So second thing was limb saving. So limb में ज़्यादा blood flow कम हो रहा है, वो blood flow achieve करना और limb को save करना, because वो एक golden hour होता है उसके बीच में होना. Third is damage control orthopedics, and further bones injuries to और कुछ damage हो, and then to maintain the patient to go to the next step. So in the operation theatre, Dr. Nitin की टीम ने उनको इंट्यूबेट किया, तो patient को full anesthesia के अंदर डालते हैं. So patient वैसे उनके ventilation पे control होता है, and then we proceed. There is lot of thing going on. इनके लिए बहुत सा blood running हो रहा है, इनके लिए बाकी भी रेडी है. तो हमने एक प्लान डिसाइड Then the cardio team was also ready in the cath lab. ये सेटल होने के बाद patient को वहाँ move करा. So within 2.5 hours, our ortho team was able to fix almost 5 major fractures. So mind me, these 5 major fractures, if we put it in a elective case, it will take almost half a day. Because we have so many hands, trained hands, and they understand what's happening, within a span of 2.5 hours, we were able to fix the pelvis, femur, stabilize the arm. As soon as we were doing the arm fixation, the plastic surgeon came in. He was simultaneously able to clean up the arm, which was all migrated. He explored the blood vessels, worked on the limb salvage. Then, patient will move from our theatre in the next door cath lab, where Dr Brajesh Kumar Kunwar and the CT surgeon, Dr took over the case. The next step was to fix the aorta. Means जो जहाँ से इनका blood loss हो रहा था, chest पे जो injury हुई थी, उसको stabilize करना. वहाँ पे stenting किया गया है, जिसके बारे में Dr Brajesh बताएंगे detail में. And along with this, there are other consultants who are coming and assessing the patient to see the different parts. So patient has a perineal injury, so general surgeon आएंगे, Dr Sameer Chaudhari, along with the urologist की जरूरत पड़ती है, Dr Kumar So this was the primary consultant team who managed it on that day. Along with this, we need to understand that it cannot just happen because of us. We need a lot of support. First support was from the family. They said just go ahead, we give full support, and that reassures doctors that we have full faith in us first. So that was the first key thing. Second thing, our administration. So our hospital has a protocol when it comes to life and limb saving. So the amount of support logistically they give us, that helps us focus on the work. Thirdly, the helping staff. The nursing staff, we are very low. Means the amount of nurses required, we are providing almost 12 to 14 for arranging consultations in 3 hours span or 4 hours span. And then there is housekeeping, there are technicians in the operation theatre who are moving around the X-ray machine, taking X-ray or cath lab technicians who are running the cath lab machine. Then there is housekeeping staff helping us stabilize, holding the patient, cleaning the patient, and everything. Apart from this, next step, I would like to highlight. After stabilizing the patient in OT, then setting life-saving procedures done in the cath lab, patient will move to the ICU. Another very critical role here. So Dr. Nitin, who was leading her and her team, has managed the patient for almost next 2 weeks in the ICU, following 2 weeks after the injury. So maintaining the patient on the ventilator, he से देखभाल हो रहा है. So हमारे ICU में एक patient के साथ एक full time nurse रहते हैं और ICU में डॉक्टर के साथ राउंड द क्लॉक इंटेंसिविस्ट की टीम होती है. उसकी वजह से we were able to make sure that round the clock patient was kept stable. Any slightest change in the patient's condition was noticed immediately in action. So in this period, the following 2 weeks, so when so much of crushing happens, the body is recovered, the body to first kilos recover, bone fractures, muscle tears, जो blood loss हुआ है, वो recuperate करना है, immunity build up करना है. So in this process, we need to hospitalize. The first incident we remember is when muscle crushing happens, वो सारा crush muscle का load टेनिस का है. उसको abdominalysis कहते हैं. Nephrologist Dr. Ashwini was able to get the patient out of it within a day or 2. Then there was a injury in the eye, so Dr. Abhishek was our ophthalmologist, noted that, and then we also were able to take care that one eye's vision is fully maintained, other had very minimal problem. So these were also managed immediately. Infection is a very big risk because इतने सारे सर्जरी हुए उस टाइम पे और crushing हुआ है मसल का, exposure हुआ है मसल को to lot of blood, mud. So how much antibiotic to use? कितने दिन देना है, कितने डोज में देना है, कब कम करना है, कब ज़्यादा करना है, क्योंकि किडनी को डैमेज ना करेगा, बॉडी को डैमेज ना करेगा. So we have an infectious disease specialist Dr. Lakshman who guide किया. To an extent that within 6 weeks, patient is almost off antibiotics. So without having a fluoride last 6 weeks. There are always risks later on. So when we speak of infection, so early, immediate, late, delayed, ऐसे parts में डिवाइड होता है. तो अभी हम ये स्टेज पे early, immediate में अभी तक पेशेंट में infection अभी तक नहीं हुआ है. Then when the patient came out of ventilation, so 2 हफ्ते बाद जो ट्यूब निकाला, पेशेंट कॉन्शियस हुए, पेशेंट को पता चलता है कि क्या क्या हुआ है. उनकी मनस्थिति जो state of mind is we just all of us cannot imagine. So there is a very important role that someone talks to. Traditionally हमारे यहाँ पे जो घर वाले बात करते हैं डॉक्टर समझाते हैं उसमें उसके अलावा एक एक्सपर्ट की जरूरत है. डॉक्टर बिल्कुल वो जो हमारे साइकोलॉजिस्ट है, she has been with the patient throughout the 6 weeks to keep his morale up, to deal with the ups and downs. So there the patient was taken care of to basically make aware कि आपके साथ क्या हुआ है और इस वजह से हमें आगे कैसे निकलना है. After ICU stay, patient is stepped down in the ventilator से बाहर है, 1 हफ्ता stable में है और उसके बाद वार्ड में है. So ward में along with our orthopedic team we need help to manage the patient. So there is a transition which we have here where the ICU intensivists would come and go and it's handed over to the physician. Dr. Pallavi Patil is the physician who has been taking care of the patient for the last 4 weeks. Along with that, I would like to mention about Dr. Nitin Jagasia and Dr. Chaudhari, who are rehabilitation and physiotherapy experts, because after we have done these surgeries to get the patient to actually use his limbs without causing stiffness, complications, the major role of physiotherapy is that. And then we have to involve the neurologist. So in patient who have major injuries नहीं थे neurologist, but then a primary assessment was done. Dr. Ravi and Dr. Shekhar Patil were involved. And of course our hospital administrators, nursing and obstetrics, as I said, is there are many things happening apart from the patient care which need to be taken care of sensibly. So many complex surgeries were performed, which were orthopedic fixation, the cardiology intervention, vascular intervention, critical care support, and lots of departments were involved from trauma, neuro, critical care, anesthesia, plastic, vascular, radiology, blood mechanism, and anesthesia. The procedures performed in the 6 weeks period, and 6 हफ्ते में 8+ major surgeries. तो एक सर्जरी को भी हम डिवाइड करेंगे स्मॉल पार्ट में, और हम भी जस्ट एनलिस्ट करने की कोशिश करें तो 12+ छोटे मोटे बड़े छोटे सारे प्रोसीजर्स हो गए हैं. ऑर्थोपेडिक वर्क मेन वर्क मेरे टीम में हाईलाइट करूंगा और प्राइमरी फिक्सेशन में हमने ट्रॉमा टीम में किया था, डॉक्टर उमेश शेट्टी, माइसेल्फ, डॉक्टर रिमान शेख. देन ऑर्थोपेडिक्स में अभी 12 से 13 सबस्पेशलिटी. So when we have a patient like this with so many injuries, so we need to basically figure out one part because one surgeon doing everything on a different area. So we have the super specialty and it gives better results and better outcome. So a couple of colleagues helped me in that. The pelvic hand surgery, elbow surgery was performed, and then main role I tell you of the soft tissue reconstruction was Dr. Charudatta Chaudhari, who is a plastic surgeon. So patient has a limb which is fully covered with skin now, without a single part exposed in 6 weeks. So he has been through multiple debridements and जो cleaning work होता है उसके बाद to make sure उनके closures होंगे ताकि सारा bone muscle tendon सब कुछ cover हुआ है, और उसके अलावा जो skin का patch होता है उसकी grafting होगी and not getting infection, the biggest aspect. So to break the fractures उनके जो हुए थे उनमें almost हमने last 6 weeks में सारे fractures fix करके soft tissue reconstruction करके skin grafting करके heart stabilizing मतलब उनके aorta stabilize करके at least reach at the stage where we can go to the next level. So in the what state now we have a dedicated physician, physiotherapy and nursing care. This is not a timetable on which patient is being put up for last 2 weeks. A bedridden patient put for 4 weeks cannot stand immediately. With given so many injuries, to get him used to standing, this is what is being used. And along with this physiotherapy, we have made sure there was infection control. 6 हफ्ते bedridden patient को without having a bed sore, without getting any urinary infection, to get him out, the nursing team, the house preventing complications of bedridden status is also very big thing, even if you have done the best of surgeries. And then to achieve the functional mobility, the patient has shown significant willpower in getting out of it and cooperating with every single consultant, nursing, housekeeping, because he also understands it's for the outcome we are working. So over the time when day 0 emergency admission, trauma activation was on day 1, stabilization surgery, 1 to 7 when the multiple life-saving procedures were ICU and ventilator support 1 week तक रहा उसके बाद निकाले गए. Rehab में nutritional support has been significant and patient has been mobilized now in wheelchair. So his recovery milestone is survived on severe polytrauma, successfully underwent multiple surgeries, stabilized after prolonged ICU care, he has regained functional mobility and he has had extraordinary recovery. This is possible when multidisciplinary expertise, critical care excellence and compassionate team care come together. Thank you.
Thank you, sir, for taking us to this remarkable journey. So, I would like to invite Dr. Brajesh to explain the endovascular interventions that help save life.
So, good afternoon, everyone. Now, whenever this type of road traffic accident happens, the most common cause of death in these people are the vascular aspect. What happens when आप speed में गाड़ी चला रहे हैं and that car hits something, there is something known as deceleration injuries. Deceleration injuries का मतलब
this is the heart. The aorta is rising like this and going like this. So this part of the heart up to this is usually free. ये free होता है. इसके बाद वाला जो नीचे वाला पार्ट है वो स्पाइन से फिक्स रहता है. तो जैसे ही आपको चोट लगती है, the upper part moves like this, but the lower part of the aorta, the main pipe, remains attached to the spine. So we call it as a deceleration injuries. Most common cause of death in these, which happens in 80 to 85% of cases, on spot death वहीं पर हो जाती है और उसकी वजह this is a deceleration injury. अभी important क्या है कि ये जो इंजरी होती है aorta को, it's not a clean injury. ऐसा नहीं एक छोटा छेद हुआ पड़ा है या छोटा सा rupture हुआ पड़ा है. The heart is the pipe is torsion, twisted, and tearing is happening. So when we have to do an angioplasty in these cases,
many things has to be kept in mind. कि वायर किस से जा रहा है नहीं, वायर फॉल्स ट्यूब में जा रहा है नहीं. अगर आप इसको ध्यान से देखें,
so this is the aorta. This is the aorta. White color. You can see how it is shattered. It is not a clear-cut lesion की कोई stenosis है, कोई ब्लॉक है, आप उसको वायर करके रिमूव कर दें. तो ये कुछ चीजें हमको ध्यान में रखनी पड़ी वायरिंग करते समय. क्योंकि once wrong step in your procedure can end up the life. What is important in this is the trust of the relatives on us, the timely support of all the team which we had. We have to decide because I felt that 1 hour, 2 hour delay this patient would have lost this patient. क्योंकि BP बहुत कम था, जब मैंने को लिया तो BP 60-70 था. And what has happened in CT scan, it was showing that this is already bleeding because the patient was bleeding into the lungs. There was a pleural effusion. So probably the bleeding has already started from there. This is torn. So our aim was to get it as early as possible. Now these तरह के stents usually hospital में available नहीं होते हैं. You cannot keep it in your जैसे हमारे पास heart के stents होते हैं totally angioplasty, हमारे पास कम से कम 1000 stents पड़े होंगे हमारे शॉप में. जब जरूरत होती है तो हम लगाते हैं. ये stents होते हैं, ये स्पेशली ऑर्डर करने होते हैं उस साइड से देख करके, क्योंकि इनका स्पाइन भी कम रहता है. कोई भी हॉस्पिटल इसको अपने पास स्टोर करके नहीं रखता है. तो हमारे पास 1-2 घंटे में टाइम था कि हम स्टेंट को उसी पर्टिकुलर साइज के स्टेंट को अवेलेबल कराएं और उसको यूज करें और पेशेंट को जितना जल्दी बिफोर द पेशेंट कोलैप्सेस डाइज, बिकॉज़ एज आई सेड 80 to 85% केसेस में इस तरह की इंजरीज फेटल ऑन द स्पॉट. Patient does not reach the hospital. If the patient has reached hospital, patient is very lucky. So we knew that the time is very less. This is very important. And
And the timely coordination was very important because when I got a call that this is the case, I immediately came rushing to the emergency department. From there, I went to the CT scan radiology department, understood what exactly the CT is showing us and what will be our plan. And then coordinated with the orthopedic team, I told them that the cardiac part, the vascular part is very, very important. We have very less time to deal with it. And that was the reason why patient was shifted directly from operation theatre to the cath lab. And within no time, we just fixed it up. So once this vascular injury was fixed, we were sure that अगर अभी chances patient के बचने के बहुत ज़्यादा हैं. Please understand that in spite of putting all the efforts, still it was possible to lose the patient. But getting all those things at a time, available within 2-3 hours, you stabilizing the patient was possible in an organization like Apollo, the level at which we are working. So we could do it, and this is one picture of the same patient before the procedure.
Can you imagine this? This is the place. Now what has happened? This pipe has ruptured and gone like this. See, this is the pipe. There is a pipe. It has ruptured like this and it has gone up. So I have to come like this, rewire it like this, and then cross the lesion.
So any small mistake would have, and this is the finally it appears like.
This is how our stent appears like. So these stents are not porous.
These are all covered stents. एक बार आपने इसको लगा दिया तो अब इसमें से ब्लड लीक होने के चांसेस जीरो हो जाते हैं. So once you put this, so we have to start from where to start with, because if you start from a place where other vessels are arising, you will end up closing them. तो आपको ये देखना है, अपना लैंडमार्क तय करना है, कहाँ से निकालना है, कहाँ तक जाना है, उस पर्टिकुलर साइज का, डायमीटर का, लेंथ का, क्योंकि ये अगर इससे लंबा हो गया तो यहाँ पर पेट की नसें निकलती हैं, तो वो ब्लॉक हो जाएंगी क्योंकि ये कवर्ड सेट होते हैं. तो ये सारी की सारी चीजें सेटल करने में 1 घंटे के अंदर हो जाना was only possible in Apollo. I was in multiple hospitals, but probably this patient said only because of the infrastructure we had, the team we had, and hats off to the ER. I mean, Dr Nitin की टीम ने जिस तरह से सॉर्ट आउट कर लिया चीजें कि आपने ये कर लिया, अब ये लोगों को इन्वॉल्व करना है, जल्दी करना है. That is very very important. Otherwise, you know what happens? This patient goes to ICU. ICU में पहले ब्लड लगता है, ब्लड स्टेबलाइज होता है, पेशेंट तब तक तो चांस नहीं मिलता. मुझे लगता है कि अगर मैंने ये प्रोसीजर 1 घंटा और डिले कर देता, this story would have ended there. That is something.